So we will now continue to live record the public comment session. As a reminder, your recorded comments will be distributed to the MTA board and will be posted to our board meeting webpage and YouTube channel. So our next speaker is going to be Ruth Lowenkron, followed by Joseph Mazaros.
Thank you, Ruth Lowenkron, New York Lawyers for the Public Interest, member of Accessory Reform Group, ARG. I'm going to take a little bit of time in addition to my 2 minutes because I feel that I have just been confronted with something that I feel is very unfortunate, and that is the manner in which speakers are chosen, because I know that I was on a list before some of the people who spoke today. So I would like the MTA to look into how that happens so nobody can accuse you of discriminating amongst your speakers. Now I'll get to the important topic that I have for you today, and that's about masking, as others have spoken about. Masking is critical. I'm going to stick to talking about masking on Accessoride. Elsewhere is important too, but it has to happen on Accessoride. And I see that the board members around the room, or I saw, some of you don't have masks, and that's fine. As you said of yourselves, you do you. That's great. But I'll bet that if any of you were on a small, crowded, incredibly long tour of the boroughs with multiple strangers, you would think about masking too. And I'm talking about the typical Accessoride ride. Or certainly if someone asks you to mask in that context, you would mask. Well, I'm asking you. My colleagues are asking you. The disability community is asking you. And we need to have the moral and the legal outrage of the MTA to put that mandate back in place. As my colleague said, what are you waiting for? CDC advises it. The Public Health Commissioner advises it. Our mayor is advising it. What are you waiting for? And what speaks against it? It's the right thing to do. It's the legal mandate, and it costs the MTA nothing. As my colleague also said, please lead. Do not be like some other leaders of this country who shall go nameless, who did not lead and led to many, many, many deaths.
Ruth, your time is up.
This is the time to act, and I ask you to act now.
Please conclude your remarks, Ruth.
I will conclude my remarks. I have also asked the communications director to hand out a statement that ARG has written, and I hope every board member receives that and acts immediately and discusses this in today's meeting. Thank you so much.
Our next speaker is going to be Joseph Mazaros, followed by Sally Wolf.
Good morning. I'm a biophysics researcher here in the city at Columbia University Medical Center. I'm speaking in my individual capacity as a New Yorker. I made the trip down here to talk about something very important to me, public health. These are the N95 masks I distribute on the subway to people who want them and need them. Think about this. People like me, a full-time medical researcher with six-figure student loan debt, are spending our time and money to make a small dent in the huge gap in public awareness about respiratory viruses and access to masks. Who on the board knows that COVID will be the third leading cause of death of Americans for the third year in a row? Who on the board knows that in 1 year, COVID kills more Americans than a decade of flu? That millions of Americans are disabled by long COVID? Probably not many, because government agencies like MTA give us the false sense of security that everything will be fine. You do you, right? But COVID isn't the only respiratory pandemic circulating, and it won't be the last. What we need from MTA now, we need mandates, but we also need education. And we need masks. We need a mask mandate on the subway because people cannot choose to avoid the subway. It is how people get to work. We need education. People do not understand what types of masks offer real protection when we are in the world of one-way masking and rugged health individualism. We need funds for N95 masks, especially in low-income communities. I'm a scientist. I'm trained here in New York at Columbia University. I know masks have been scientifically proven time and again to be effective in preventing respiratory viruses, not just reducing severity, but actually reducing cases. I implore the MTA to increase education about masks, to procure funding for masks, and to reinstate mandates in places where people have to be. We need to give up on rugged health individualism. We need MTA to do its part to deliver public health. It's a matter of life and death.
Yeah.
Thank you. Our next speaker is going to be Sally Wolf, followed by Para Girl.
Hello, everyone. My name is Sally Wolf. I live in Flatiron, although I am zooming in from my parents' house in Great Neck, having taken the train to get here. This is my 4th month here. When I first came in September, I shared how I walked 3 miles each way to Memorial Sloan Kettering in 95-degree heat because my oncologist did not feel that the trains were safe for me as an immunocompromised New Yorker. And now I worry I'll be repeating that same walk in 20-degree winter chills. That is ridiculous in a city that has such an incredible train system, one I preferred over cabs to take to my double mastectomy and intense chemotherapy sessions several years ago. But now we're juggling multiple airborne illnesses, a triple-demic by multiple accounts, and while many people are still feeling cautious and masking, the current you do you situation gives us no way to surround ourselves by fellow passengers who are taking the same precautions. The pandemic did not create challenges for immunocompromised people so much as highlight how hard it can be for us to feel safe in a densely packed city. We already struggled, and the pandemic gave us a moment in time now to take information like that and create change. I optimistically thought you would hear and take action on the idea for masked cars or sections of cars, both for the subway and the commuter rails. We could have piloted this in the summer or fall when less virus was circulating. We now need to skip a pilot. We need to implement. We need to let it be safe in the midst of this worst health crisis. And I want you to think of a terrible health crisis that you or a loved one has navigated. Of all the things you probably worried about, I would guess that getting to the hospital or getting to an appointment safely was not something you worried about. But many of us now have that struggle. So I am asking,
Please conclude your remarks.
meeting with you, and I am concluding, thank you very much, in this overflow room that I waited to attend. I am concluding to ask, help
Sally,
us.
please conclude your remarks.
Thank you very much for this very limited time that I waited so long to have. Happy holidays.
Thank you. Our next speaker is going to be Kara Girl, followed by Dr. Lucky Tran.
Okay, sounds good. Thank you. Okay. Good morning. I'm Kara Girl, Research and Communications Associate at the Permanent Citizens Advisory Committee to the MTA, PCAC. Like many riders, we've been waiting eagerly to hear about an opening date for East Side Access. We welcome the news of Grand Central Direct shuttle service between Grand Central and Jamaica before full service begins, but with 10 days left in 2022, the clock is ticking to open even this modified service before the end of the year. We hope that by running the Grand Central Direct shuttle as phase 1, you can collect enough feedback to iron out any issues and adjust accordingly before officially implementing new Long Island Railroad schedules. We're also glad that the shuttle will operate in addition to full service to Penn Station in the meantime. If opened in time, this will create a more seamless traveling experience during this busy holiday season, especially for those going to and from JFK. The new combo ticket is a great step and represents a future where riders can seamlessly transfer between trains at one station on one ticket and in one app. The next step is full freedom ticket implementation with reduced commuter rail fares within the city and an option to transfer to the subway or bus. But for riders within the city, for example, going from Fordham on Metro North to Jamaica on the Long Island Railroad, it will still be more affordable to get 2 separate $5 city tickets for each railroad than the off-peak $7.25 Metro North fare, plus $8 for the second leg. We're thankful that the new New York panel has recommended for city ticket to apply 24/7, and are hopeful that riders traveling within the city will soon be able to transfer more affordably between all of the modes the MTA has to offer with Freedom Ticket. We've long called for fair fares expansion to people making 200% of the federal poverty line instead of the 100% it currently is. Next, we hope to see the city pay for fair fares expansion to the commuter railroads as well to help the many low-income New Yorkers living in subway deserts access nearby commuter rail stations. These initiatives all take money, and we'll keep fighting for transit to be funded like the essential service it is. Thank you.
Thank you. Our next speaker is going to be Dr. Lucky Tran, followed by Myra Batchelder.
Hi, my name is Dr. Lucky Tran, and I'm a scientist and public health communicator who works at Columbia's Medical Center. I'm speaking to you yet again to urge you to reinstate the mask mandate for public transit. I mean, I can't believe there isn't more action on this. Since the last time I spoke, COVID levels have surged even more. All 5 boroughs of the city, all of Long Island, and several neighboring counties are at high COVID community levels. Hospitals in the US are the fullest they've been throughout the pandemic. Why is the MTA still dragging their feet on requiring masks for public transport? The CDC recommends universal indoor masking when COVID community levels are high. New York City has issued an advisory for everyone to mask indoors and in crowded settings. Why are you ignoring guidance from the CDC and the city? And even 3 years in, poll after poll shows that a majority of people in the US support mask mandates. 7 in 10 New Yorkers support mask requirements for the public transport. The MTA's own data shows that early in 2022, when there was a mask mandate in place, 90% of riders wore masks. Why are you ignoring the will of your own riders? And the more you continue to dawdle on mask mandates, the more you prevent our most vulnerable New Yorkers, including immunocompromised, disabled, and the elderly, from fully participating in society. When there are no mask mandates, they can't ride public transport to get to medical appointments, get groceries, or access other essential services without seriously risking their health. How is this acceptable to anyone here? All New Yorkers have the right to access public transport. I urge the MTA to take responsibility and do whatever it takes to get the mask mandate for public transit back in place, whether that means pushing the city or the state or simply reinstating it yourselves, which I remind you, you have the ability to do. Do the right thing, please. Thank you.
Thank you, Dan. The next speaker is going to be Myra Batchelder, followed by Dan Gonzalez.
Hi, my name is Myra Batchelder, and I'm from the group Mandate Masks and Why. I'm here today to ask the board to reinstate the mask mandate on the MTA. All of New York City and surrounding counties have high community levels of COVID-19, according to the CDC, which means high community transmission and high hospitalizations. What are you waiting for? As we know, in fact, COVID rates are vastly undercounted because home tests aren't counted in New York City and many other counties. Experts at Institute for Health Metrics and Evaluation estimate COVID cases in the US are likely 20 to 25 times higher than are being reported. So when you see the New York City numbers, double, like times that by 20 to 25. The rates are much higher than are even being reported. We are in the midst of a large COVID surge and are not taking the steps needed to mitigate it. This is putting people's lives in danger every day. We need to reinstate the mask mandate on public transit. New Yorkers support mask mandates on public transit, as you've heard today. A poll done earlier this year showed 7 in 10 New York City voters supported mask mandates on public transit. Around 55% of households in New York City don't own a car. In Manhattan, it's around 78%. We all rely on public transportation to get to doctor's offices, hospitals, work, school, and everywhere. Ending the mask mandate on public transit has made our lives more unsafe, especially for those of us who are at higher risk for severe COVID. In addition, it's very important to point out that everyone is at risk from COVID. Long COVID and serious health issues can happen to anyone after COVID. We urge you to reinstate the mask mandate on the MTA. Stop waiting. Save people's lives now. Work to protect people's lives. We are in the midst of a COVID surge. In addition, I would just like to point out it is strange as someone who signed up at 9:30 a.m. to be called so late on this call. And so I hope you will look at how you decide the order of who is placed, because I signed up at 9:30 and find it very strange I am one of the last people to speak. So please look into that. Thank you for listening to us.
Myra, thank you. Our next speaker is going to be Dan Gonzalez, followed by Jackie Cohen.
Oh, there we go. Good morning, all. My name is Dan Antonio Gonzalez. I'm a resident of the tippy top of Manhattan and a case manager at a homeless LGBTQ youth center. I'm not as eloquent as my fellow community members in this meeting who have given me goosebumps, but I'm here to urge the MTA to reinstate mask mandates. To echo what others have said, COVID cases, flu, and RSV cases are rising. I wear an N95 mask every day on the train, but masking myself is not enough when everyone around me is maskless. The disgraceful "you do you" signs were apparently removed, but that's not enough. The mask mandate needs to be reinstated because we do not have the choice to take the train. It is our only transportation to work. When you pack us in cars like sardines, every day we are forced to breathe each other's air. The MTA is enabling and allowing the illnesses and deaths of community members by pretending masking is not important, by ignoring the CDC guidelines. It is encouraged, but encouragement means nothing to people who are poor, sick, and disabled. Every day that masks are not required and easily accessible is a day that the MTA says poor, disabled, elderly, and high-risk people do not matter. We are not worth being included in society. We don't matter. Our ability to get to work, to go to a friend's house, to live our lives is not being considered. We are denied that privilege that apparently everyone gets. This is an emergency. Mandate masks immediately. And I do not say thank you to the MTA or this session where I was allowed 2 minutes of time, but I say thank you to my fellow community members who are speaking about this.
Thank you. Our next speaker is going to be Jackie Cohen, followed by Anna Packman.
Hi, good morning. My name is Jackie. I used to be a frequent MTA commuter, and I'm here to ask the chair and the board to reinstate the mask mandate on the MTA. According to the CDC, we know COVID transmission is currently very high in New York City, and we're in the middle of a COVID surge. We know that masks are one of the best ways to prevent respiratory virus transmission, and we know that they work much better when everyone is wearing one, because that's what reduces the virus in the air. This is a community problem, not an individual one. My wearing a mask alone doesn't much reduce the virus in the air on a crowded train when transmission is high, but nearly all of us wearing masks does reduce that virus in the air. Up until earlier this year, even in the pandemic, I commuted on the subway and bus often, and I encouraged friends to do so too. I often commuted to New Haven on Metro North because the mask mandate meant it was pretty safe. Now it's not safe, and I avoid it as much as I can. Now that the transmission of COVID is so high in New York and there's no mask mandate, it's not safe right now for me and my family to take MTA transit. I have family members who are immunocompromised and elderly who I care for and live with. Those are the people who take the hardest hit from the recent variants. And so the lack of mask mandate is making preparation for the holiday season really depressing and frustrating for me. I used to be able to take the train to get groceries and gifts with my family. Now I can't. Because of the lack of transit masking, this is the least safe I have felt during any pandemic winter holiday so far. A few months ago, because there's no mask mandate, I stopped purchasing monthly Metro cards. I can't use them safely anymore, and it's not worth my money. I would love to be able to purchase them again because I am so proud of the MTA, or used to be. But now, since I'm avoiding MTA transit because of the lack of mask mandate, I don't need them. And I'm one of the privileged people who can make that choice. Most people can't. Please reinstate the mask mandate on the MTA. It's time to do the right thing for New York. Thank you.
Thank you. Our next speaker is going to be Anna Packman, followed by John Mayer.
Hi, my name is Anna Packman. I am here in my personal capacity. I am here to ask the question, why? Why, when the New York City Department of Health Commissioner, the CDC, many public experts who you've heard from today, as well as people across the country who are experts about local health, which by the way, you are not, are recommending a mask mandate in New York City and our surrounding counties because the rates are so high, by the way, 3 times higher than what the CDC would consider a high enough rate to recommend masks is the rate that we're seeing day to day in New York City right now. Why are you not mandating masks? It's not only the right thing to do, but you are violating my rights as an individual with disability and the rights of probably over at least 1 million high-risk New Yorkers. This is a civil rights issue. You cannot let this pass. By choosing not to do anything, you are making a choice to make people sick, to make people disabled, and also a lower rate than 2020 granted to make people die. You are making that choice, and you alone have the ability to make it stop immediately. So please reinstate the mask mandate. And also, since I have a minute left, let me share how this is also affecting our lives everywhere else. I also have the privilege of avoiding the MTA, including Access Ride. And I'm still at more risk because more people are getting sick because they're getting on the subway and getting sick so they can get me sick in other places that I cannot avoid, including my own home. In my apartment building, we mandate masks. Fewer people have been wearing them since the mandates disappeared on the MTA in September. So again, please mandate masks. Thank you.
Thank you. Our final speaker is going to be John Mayer.
Hi, my name is John Meyer, and I am a board member of Civics United for Railroad Environmental Solutions, also known as CURES, and a resident of Ridgewood, Queens. Ridgewood and its surrounding neighborhoods have extensive areas designated as disadvantaged communities in New York State's Climate Leadership and Community Protection draft maps. My neighbors and I are being harmed every day by pollution from 1970s freight locomotives owned and operated within the MTA system by the Long Island Railroad and the New York and Atlantic Railway. On August 28th, the CURES board received a report from a Glendale resident about plumes of toxic exhaust from freight locomotives in her neighborhood. CURES wrote to President Rinaldi and the New York and Atlantic Railway asking what railroad was responsible. We have consistently called LARR's attention to the fact that they have a $20 million comptroller's contract number DR 36644 to repower old freight switcher locomotives to Tier 4, and that their procurement has been open for nearly 4 years now. On September 1st, the LIRR's Hector Garcia wrote to us the following. That was an LIRR work train. We are still actively in procurement for their Tier 4 locomotives to replace LIRR and New York and Atlantic locomotives. When CURES wrote back and asked what the timetable was for completing the procurement, LIRR did not respond. On September 17, the same resident, who was a retired nurse, reported another locomotive belching exhaust plumes. She wrote to us, how anyone could think that this is acceptable for this to pass my house. Schools and playgrounds is beyond me. I had to close my windows yet again. Little infant lungs, toddler lungs, elderly lungs, everyone's lungs are assaulted by these fumes. Think about how many neighborhoods from Queens out to Long Island that this is passing. It's a shame that suggestions to repower these ancient polluters to near zero emissions has fallen on deaf ears. We ask you again, President Rinaldi, when will this procurement be completed? Thank you.
Thank you all for your participation and your comments. This concludes the public comment session.